Have you been feeling more tired than usual lately? Maybe you've noticed a nagging pain in your upper abdomen, or perhaps you've lost a few pounds without even trying. It's easy to dismiss these kinds of changes as a normal part of getting older. After all, aches and pains become more common with age, digestion isn't always what it used to be, and energy levels naturally fluctuate. But sometimes, these seemingly ordinary symptoms can point to something much more serious. One of the most challenging cancers to detect early is pancreatic cancer. It often develops quietly, causing symptoms that are vague and easy to mistake for other health conditions. By the time clear warning signs appear, the disease may already be advanced. That is why paying attention to your body is so important, especially as you get older. While these symptoms do not automatically mean you have pancreatic cancer, they should never be ignored. Recognizing them early and discussing them with your healthcare provider could lead to earlier testing and, in some cases, earlier treatment. In today's video, we're going to discuss 8 symptoms of pancreatic cancer that seniors should never ignore. Stay with us until the end, because many people are surprised to learn that some of these warning signs don't involve pain at all. Let's begin with the first symptom. The first warning sign is persistent abdominal pain. Many people experience occasional stomach discomfort after eating a large meal or dealing with indigestion. Usually, this kind of pain comes and goes and improves on its own. Pain caused by pancreatic cancer is different. The pancreas sits deep inside the abdomen, behind the stomach. As a tumor grows, it can press against nearby nerves and organs, causing a dull, persistent ache. Many people describe the discomfort as being located in the upper middle abdomen. For some, the pain spreads through to the middle or upper back. At first, the pain may seem mild. It might only appear after eating or while lying flat. As time goes on, however, it often becomes more frequent and more noticeable. Some individuals find temporary relief by leaning forward while sitting. Others notice that pain medication provides only limited improvement. Because stomach pain is so common, many people assume it's acid reflux, a pulled muscle, or simply getting older. But if abdominal pain lasts for several weeks, continues to worsen, or repeatedly returns without a clear explanation, it's important to seek medical evaluation. Persistent pain is your body's way of telling you that something deserves attention. The second symptom is unexplained weight loss. Losing weight without changing your diet or exercise routine is never something to ignore. Many seniors are pleased when the number on the scale goes down. However, when weight loss happens unexpectedly, it may be a sign that the body is struggling with an underlying illness. The pancreas plays a critical role in digestion. It produces enzymes that help break down fats, proteins, and carbohydrates from the foods we eat. When pancreatic cancer interferes with this process, the body may no longer absorb nutrients efficiently. Even if you're eating the same amount of food, or even more than usual, you may still begin losing weight. Some people notice their clothes fitting more loosely. Others find they have less muscle strength or feel weaker climbing stairs or carrying groceries. In addition, cancer itself can change the body's metabolism. Tumors often consume energy and trigger inflammation, causing the body to burn calories more rapidly than normal. If you've lost 10 pounds or more over a relatively short period without trying, it's worth discussing with your healthcare provider. Weight loss doesn't always mean cancer. It can also result from thyroid disorders, diabetes, digestive diseases, depression, or other medical conditions. But because pancreatic cancer frequently causes unexpected weight loss, it should always be taken seriously. The third symptom is jaundice. Jaundice is often one of the earliest noticeable signs of pancreatic cancer, particularly when the tumor develops near the head of the pancreas. This symptom occurs when a substance called bilirubin builds up in the bloodstream. Normally, bilirubin flows from the liver through the bile ducts into the intestines. If a tumor blocks one of these ducts, bilirubin cannot drain properly, causing it to accumulate in the body. One of the first things people notice is that the whites of their eyes begin turning yellow. Soon afterward, the skin may also develop a yellow tint. Friends or family members often notice this change before the individual does. Jaundice may also be accompanied by dark-colored urine, pale or clay-colored stools, and itchy skin that can become extremely uncomfortable, especially at night. Unlike temporary skin discoloration from certain foods or medications, jaundice requires prompt medical attention. There are several possible causes, including gallstones, liver disease, hepatitis, and pancreatic cancer. Determining the exact cause requires medical evaluation, blood tests, and imaging studies. If you or someone you know develops yellowing of the eyes or skin, don't wait to see if it improves on its own. Seek medical care as soon as possible. The fourth symptom is changes in digestion and bowel habits. Many digestive problems become more common with age, but persistent or unusual changes deserve attention. Because the pancreas helps digest food, pancreatic cancer can interfere with normal digestion. People often notice frequent bloating after meals, excessive gas, nausea, or a feeling of fullness after eating only a small amount of food. Another important clue involves changes in stool. When the pancreas doesn't release enough digestive enzymes, fat isn't absorbed properly. As a result, stools may become pale, greasy, oily, bulky, or difficult to flush. They may also have a particularly strong odor. Some people notice an oily film floating in the toilet water. These symptoms may seem embarrassing to talk about, but they provide valuable information about digestive health. If digestive changes continue for several weeks, especially when combined with weight loss or abdominal discomfort, it's important to seek medical advice rather than assuming they're simply due to aging or a sensitive stomach. The sooner the cause is identified, the sooner appropriate treatment can begin. Many people live with digestive symptoms for months before seeking help because they hope the problem will disappear. Unfortunately, waiting can delay the diagnosis of serious conditions. Your body often gives subtle warnings long before a disease becomes advanced. Paying attention to those warnings and acting on them is one of the most important steps you can take to protect your health. The fifth symptom seniors should never ignore is new onset diabetes or sudden changes in blood sugar levels. Most people think of diabetes as a condition related to diet, weight, or family history. While those factors certainly play a role, there's another connection that many people don't realize. The pancreas is responsible for producing insulin, the hormone that helps regulate blood sugar. When a tumor develops in the pancreas, it can interfere with insulin production, making it difficult for the body to control glucose levels. In some cases, diabetes actually develops months before pancreatic cancer is diagnosed. This doesn't mean that everyone with newly diagnosed diabetes has pancreatic cancer. In fact, the vast majority do not. Type 2 diabetes is very common, especially among older adults. However, when someone over the age of 50 develops diabetes without obvious risk factors, or when long-standing diabetes suddenly becomes much harder to control, it deserves careful medical attention. You may notice that you're feeling unusually thirsty throughout the day. You might need to urinate much more often, especially during the night. Some people experience blurred vision, increased fatigue, or slow healing of small cuts and bruises. Others discover elevated blood sugar only during a routine blood test, even though they feel relatively well. Doctors are becoming increasingly aware of the relationship between pancreatic cancer and new-onset diabetes. If diabetes appears unexpectedly alongside unexplained weight loss, abdominal pain, or digestive problems, additional evaluation may be appropriate. Again, diabetes is far more likely to have other causes, but understanding this possible connection may help some people receive an earlier diagnosis. The sixth symptom is persistent fatigue and unusual weakness. Everyone feels tired once in a while. Poor sleep, stress, busy schedules, and many common medical conditions can all leave you feeling exhausted. But the fatigue associated with pancreatic cancer is often different. Many people describe it as a deep, overwhelming exhaustion that doesn't improve after a full night's sleep or an afternoon nap. Simple daily activities suddenly become difficult. Walking around the grocery store feels like a major effort. Climbing a flight of stairs leaves you unusually winded. Preparing meals, gardening, or playing with grandchildren becomes much more tiring than it used to be. Cancer places tremendous demands on the body. It can trigger inflammation, alter metabolism, reduce appetite, and interfere with nutrition. Together, these changes gradually drain energy and muscle strength. Anemia, which is a lower than normal number of healthy red blood cells, may also develop in some individuals, contributing to weakness, dizziness, and shortness of breath. Because fatigue is so common among older adults, it's easy to dismiss it as a normal part of aging. However, persistent fatigue that is new, unexplained, and progressively worsening should never be ignored, especially when it occurs alongside other symptoms we've discussed. Pay attention to changes in your normal energy level. Your body often notices when something isn't right long before a diagnosis is made. The seventh symptom is pain that spreads to the back. Earlier, we discussed abdominal pain, but pain that radiates into the back deserves special attention because it is one of the more characteristic symptoms of pancreatic cancer. The pancreas is located close to several major nerves near the spine. As a tumor grows, it may press against these nerves, creating pain that begins in the upper abdomen and extends through to the middle or upper back. Some people feel the pain between their shoulder blades. Others describe it as a constant, dull ache that never completely goes away. Unlike muscle pain from lifting something heavy or sleeping in an awkward position, this discomfort often has no obvious cause. It may become worse after eating. It may also intensify when lying flat in bed, causing interrupted sleep. Some people discover that leaning forward while sitting provides temporary relief because it changes the pressure around the affected nerves. Back pain is extremely common, particularly among seniors. Arthritis, osteoporosis, spinal disc problems, and muscle strain account for the vast majority of cases. However, back pain that appears together with unexplained weight loss, digestive symptoms, jaundice, or persistent abdominal discomfort should not simply be blamed on aging. Looking at the complete picture is what matters most. One symptom by itself may not seem concerning. Several symptoms occurring together tell a very different story. The eighth and final symptom is loss of appetite or feeling full very quickly. Most of us occasionally skip a meal because we're busy or simply not hungry, but pancreatic cancer often causes a gradual decline in appetite that continues over time. Foods you once enjoyed may suddenly seem unappealing. You may begin eating smaller portions without intending to. After only a few bites, you feel completely full. Some people develop nausea after meals. Others notice that certain foods, especially fatty or greasy meals, become difficult to tolerate. As appetite decreases, weight loss usually follows. This creates a cycle in which reduced food intake leads to weakness, muscle loss, and even greater fatigue. Family members are often the first to notice these changes. They may comment that you're eating much less than usual or leaving most of your meal untouched. Although loss of appetite can occur with many different illnesses, including infections, depression, medication side effects, and digestive disorders, persistent appetite changes should always be evaluated by a healthcare professional. Our bodies are remarkably good at sending signals when something is wrong. The challenge is recognizing those signals before they become impossible to ignore. As we've discussed today, pancreatic cancer rarely announces itself with one dramatic symptom. Instead, it often presents with several subtle warning signs that gradually appear over weeks or months. Persistent abdominal pain, unexplained weight loss, yellowing of the skin or eyes, changes in digestion and bowel habits, new onset diabetes or worsening blood sugar control, persistent fatigue, pain that spreads to the back, and a noticeable loss of appetite. None of these symptoms automatically means you have pancreatic cancer. In fact, there are many other conditions that can cause similar problems, and most people experiencing one of these symptoms will ultimately have a different diagnosis. However, what should never be ignored is the combination of symptoms, especially when they persist, worsen over time, or cannot be explained by another condition. If you notice these changes in yourself or someone you love, schedule an appointment with a healthcare provider. Early evaluation can identify many different medical conditions, and if something serious is present, finding it sooner often provides more treatment options than waiting. It's also important to keep up with routine medical visits, discuss any new or unusual symptoms honestly, and never feel embarrassed about bringing up digestive issues, changes in bowel habits, or unexplained pain. These conversations may be uncomfortable, but they can be incredibly important for your health. Remember, your body is constantly communicating with you. Listening carefully to those signals and seeking medical advice when something doesn't feel right is one of the best investments you can make in your future health. Thank you for spending this time with us today. If you found this information helpful, consider sharing this video with your family and friends. Someone you care about may recognize a symptom they've been overlooking, and that conversation could encourage them to seek medical attention. If you enjoy educational videos about healthy aging, disease prevention, and practical wellness tips for seniors, be sure to subscribe and turn on notifications so you won't miss our upcoming videos. Until next time, take care of yourself, stay informed, and remember that paying attention to your health today can make a meaningful difference tomorrow. Before we wrap up, let's talk about something just as important as recognizing the symptoms, understanding who is most at risk for pancreatic cancer. While pancreatic cancer can affect adults of any age, it is diagnosed more often in people over the age of 60. As we get older, our risk naturally increases. That doesn't mean aging causes pancreatic cancer, but it does mean seniors should pay closer attention to persistent changes in their health. Smoking is one of the biggest risk factors. In fact, researchers estimate that cigarette smoking is responsible for a significant percentage of pancreatic cancer cases. The harmful chemicals in tobacco can damage the DNA of pancreatic cells over time, increasing the likelihood that cancer may develop. The good news is that quitting smoking can gradually lower this risk. It's never too late to stop. Whether you've smoked for 5 years or 50 years, your body begins repairing itself almost immediately after quitting. Another important risk factor is obesity. Carrying excess body weight, particularly around the abdomen, has been linked to chronic inflammation and changes in hormone levels that may increase the risk of several types of cancer, including pancreatic cancer. This doesn't mean everyone who is overweight will develop cancer. Far from it. But maintaining a healthy weight through balanced nutrition and regular physical activity can benefit nearly every organ in your body, including the pancreas. Family history also matters. If several close relatives have had pancreatic cancer, your own risk may be higher than average. Certain inherited genetic conditions can also increase the likelihood of developing this disease. If pancreatic cancer runs in your family, don't keep that information to yourself. Share it with your healthcare provider. They may recommend genetic counseling or additional screening depending on your personal and family history. Chronic pancreatitis is another condition associated with increased risk. Pancreatitis is inflammation of the pancreas. When this inflammation continues for many years, it may damage pancreatic tissue and increase the chance of abnormal cell growth. Heavy alcohol use can contribute to chronic pancreatitis in some people, which is one reason doctors encourage moderation or avoiding alcohol altogether if you have pancreatic disease. Now, you may be wondering, if I have one or more of these risk factors, should I be worried? The answer is not necessarily. Having a risk factor does not mean you will develop pancreatic cancer. Many people with risk factors never do. At the same time, some people diagnosed with pancreatic cancer have no obvious risk factors at all. Risk factors simply help doctors understand who may benefit from closer attention if symptoms appear. That's why listening to your body remains so important. Let's also discuss how pancreatic cancer is diagnosed. Unlike some cancers, there isn't a simple routine screening test recommended for everyone. Instead, doctors rely on a combination of your symptoms, medical history, physical examination, blood work, and imaging tests. If pancreatic cancer is suspected, your doctor may order a CT scan or an MRI to obtain detailed images of the pancreas and surrounding organs. Sometimes a specialized procedure called an endoscopic ultrasound is recommended. During this procedure, a thin, flexible tube with a small ultrasound device is passed through the mouth into the stomach and small intestine. Because the pancreas sits just behind these organs, doctors can obtain highly detailed images and, if necessary, collect a small tissue sample for testing. Blood tests may also be performed to evaluate liver function and look for changes that suggest blocked bile ducts or other abnormalities. In some situations, doctors measure a protein called CA19-9. While this blood marker can be elevated in pancreatic cancer, it is not accurate enough to diagnose the disease by itself. Other conditions can also raise CA19-9 levels, and some people with pancreatic cancer have normal results. This is why doctors look at the entire picture rather than relying on a single test. Many people hesitate to seek medical care because they're afraid of what they might hear. That feeling is completely understandable. But avoiding an evaluation doesn't make a medical problem disappear. In fact, delaying medical care often gives illnesses more time to progress. On the other hand, many people who seek medical attention for symptoms such as abdominal pain, weight loss, or digestive changes discover that the cause is something entirely treatable, such as gallstones, stomach ulcers, acid reflux, or another digestive condition. The only way to know is to be evaluated. Early answers are almost always better than unanswered questions. It's also worth remembering that pancreatic cancer is not the most common cause of these symptoms. This point cannot be emphasized enough. Abdominal discomfort, fatigue, loss of appetite, and weight changes are much more commonly caused by conditions other than pancreatic cancer. The purpose of this video isn't to create fear. It's to encourage awareness. Awareness helps people recognize when symptoms are persistent, unusual, or occurring together. Awareness encourages conversations with healthcare professionals, and awareness has the potential to save lives by helping serious conditions be identified sooner rather than later. So, what should you do if you notice one or more of these warning signs? First, don't ignore them. Second, write down your symptoms. Keep track of when they started, how often they occur, whether they are getting worse, and anything that seems to improve or worsen them. This information can be extremely helpful for your healthcare provider. Third, schedule a medical appointment if symptoms continue for more than a couple of weeks, become progressively worse, or are accompanied by unexplained weight loss, jaundice, or severe pain. Finally, continue taking care of your overall health. Eat a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Stay physically active within your abilities. Avoid smoking. Limit alcohol if your doctor recommends doing so. Manage chronic conditions such as diabetes and high blood pressure. And don't skip your routine medical checkups. Small healthy habits performed consistently over time can have a meaningful impact on your long-term well-being. As we close today's video, remember these 8 warning signs: persistent abdominal pain, unexplained weight loss, jaundice, digestive changes, new onset diabetes, ongoing fatigue, pain that spreads to the back, and loss of appetite. Most people experiencing one of these symptoms will not have pancreatic cancer. But persistent symptoms deserve attention, not assumptions. Your health is one of your most valuable assets, and paying attention to changes in your body is one of the most important things you can do for yourself and your loved ones. Thank you so much for watching. If this video has helped you learn something new, please click the like button and share it with friends and family. You never know who may benefit from recognizing these warning signs early. If you're new to the channel, don't forget to subscribe and turn on the notification bell. We post new videos every week covering healthy aging, disease prevention, nutrition, and practical wellness tips designed to help you live a healthier, stronger, and more informed life. Until next time, stay healthy, stay proactive, and remember, when it comes to your health, paying attention today could make all the difference tomorrow.